podcast with my friend Dr. Khalid. He's also a neurosurgeon. We will have a good conversation today. So,
basically, we are preparing for American Association of Neurosurgeons, my section here in Chicago. So they have asked us to make a video for them, and inshallah we are trying our best to produce a good video so we can send them, and then it will be published by ALS.
So we both are members of American Society of Neurosurgeon, and we are proud of that we are member and providing best stuff to them.
They had already remained with us. Recently they had launched a program regarding neurotrauma.
Okay.
So they were asking us to have research on neurotrauma, and they also have changed a bit criteria to categorize different patients with response to severity. So we are going to, inshallah, also do some research in neurotrauma as well.
So Dr. Khalid, my first question from you is that why you come in the neurosurgery?
Basically, neurosurgery is a science and then arts, right?
Okay.
When you are selected as a neurosurgeon, it's a selection of God. You have all the qualities to become a neurosurgeon. Everywhere in the world, if you see them, you will find that all the neurosurgeons, behavior-wise and quality-wise, are the same. So the other thing is the patient. While you're looking into the neurosurgery, it's like an action movie, right? So some people, they like action in life, right? You really care for the patient and you really do something very huge for them, because there's a young patient, he come with a road traffic accident and just an hour back he was all right, he left the home with his parents, and then you see him in ICU.
So the same question, if it goes for me, so I always say I choose neurosurgery because the brain is so beautiful and I love to work on brain and spine. So for me, it's the beauty of the brain, and I say that Allah give respect to the brain by putting it on the top of the body.
Allah made it itself, right? Through His hand.
So the second question from you is, most of the students ask from us that what you do for your recreation. The neurosurgeon.
This is like neurosurgery is a hectic job. You have to be having some time for yourself, right? Giving your time. For that purpose, mostly me and my friend Dr. Waseef, we travel to forest, jungle on 3 days. We do hunting. Along with that, we do sightseeing. So this
it's was the same answer last time I asked from my friend Michael T. Lawton. He is the founder of Neurosurgery, and he used to tell me that I go with my family to some mountain area. He never said I go into the New York busy cities and stuff like that.
This is what brings out of your, all the anxiety what you retain from the environment.
So the next question, Dr. Khalid, I have why we are so much relaxed. Even we do a lot of hectic neurosurgery, and we always been treating. We are just battling between the life and death. But we never been into a terror or such like. So I see many times you get relaxed and you just.
Basically, what you do is you only rely on the outcome of the patients, right? When you see that I have done something good today, and for needy patients, for poor patients, that's where the relaxation lies, right? So you are confirmed, you have confidence within yourself that I have done something good for them.
Some students usually ask that how much it is the training program to be selected as a neurosurgeon. So
basically, everybody is not fit for neurosurgery, right?
Okay.
There are specific people who are chosen by God. So you have to be having good understanding of the brain from the very beginning, and you have to be a psyche of the neurosurgeon as well, where you can match yourself with those people, and then you have to work. Training is a part of game. It is like you have to do 5 to 6 years, and then you have to be having experience. With the passage of time, you become masters of the techniques, right? So nobody is perfect in neurosurgery. If somebody thinks that he had completed training and then he's a neurosurgeon, no. You have to be doing more and more and more, so this become a master.
Come closer so you can take our voice well. So another question, Dr. Khalid, I have in medical we have a lot of specialties. So which specialty you will never want to go in that one? That is.
I don't like medicine, All the day you have to be sitting with the people. I respect them, and medical specialists, I respect them a lot. it's a good job. You know, most of our elders, you know, they need medical advices. But you know, I personally, I don't like to be in medicine.
If it is on me, so I will say I had pediatrics because it's, sometimes it's very tricky to play with the little kid.
They don't know what he's saying. It's like now God willing, you are just playing with the like an enemy, right?
Tell me one question. I'm asking another question. Like, whether you selected to be a neurosurgeon as you enter into medical school, or after that you got?
Before medical school in FSC, I was very keen in painting the brain, right?
Okay.
And later on, when I was medical college, everybody claims to be some doctor specialist, right? I was claiming that I want to be a neurosurgeon, and I am a neurosurgeon. So most of my classmates, they told me, hey, he's a neurosurgeon.
For me, it was like when I was selected in the medical school. So I was the dissector of my batch, and you know, I used to dissect the dead bodies, and from there I was take a gold medal in the neuroanatomy and anatomy. So that's why I did that. I will go from very first day. I was saying that I will go into this, and even my teacher said that I one day you will become a neurosurgeon. So
of course, for the final message from the neurosurgery, yes, neurosurgeon should be having these qualities: high flight, sharp sight, prompt decision, and quick action.
And best of luck to all the graduates and undergraduates. Some people say that we are their mentor, but you know, for us, the mentor is the outcome of the patient.
This is.